The rejection letter was the 14th she'd received that year. Sarah Chen read it standing at the mailbox, not bothering to take it inside. She already knew what it would say. She'd memorized the formula by now. Thank you for your application. Impressive nursing credentials. Unfortunately, we're seeking candidates with more traditional training backgrounds. Best of luck in your future endeavors. She'd stopped feeling anything after the 7th letter. By the 14th, it was just paperwork. What hurt, what still hurt even after all this time, was the phrase, traditional training backgrounds. It was hospital speak for, we don't know what to do with you. It was a polite way of saying that 3 years as a Navy combat medic, including 18 months in the most dangerous theater of operations since Vietnam, didn't count as real medical experience. It was a way of saying that saving lives under fire wasn't as valuable as saving lives in air-conditioned operating rooms. Sarah folded the letter and slipped it into her bag. She had a shift in an hour. Westbrook Medical Center wasn't her first choice, wasn't even her 10th choice, but it was the hospital that had hired her when no one else would. The ER was chronically understaffed, the pay was mediocre, and the chief of medicine treated nurses like furniture. But it was medicine, and medicine was all she had left. If you're watching this and you've ever been told your experience doesn't count, hit that subscribe button. Because this story is about to prove just how wrong the gatekeepers can be. The ER was busy when Sarah arrived for her shift, which was normal, and understaffed, which was also normal. Chen, thank God. Dr. Michael Torres, the attending on duty, looked up from a chart with obvious relief. We've got a multi-car pileup coming in, ETA 6 minutes. I need you running trauma 2. Got it. Sarah moved to the trauma bay with practiced efficiency, checking equipment and supplies, ensuring everything was where it needed to be. Other nurses watched her work. They always did, though Sarah never quite understood why. She was just doing her job. How does she stay so calm? Jennifer Walsh, one of the newer nurses, asked Torres in what she thought was a whisper. Torres smiled slightly. Experience. She's only been here 2 years. Some experience counts more than others. The ambulances arrived in a chaos of sirens and shouting paramedics. Sarah's bay received a teenager with multiple fractures and suspected internal bleeding, a bad one, the kind that would take everything the trauma team had. She worked without thinking, her hands moving through procedures she'd done hundreds of times in conditions far worse than this clean, well-lit trauma bay. Start the IV. Call for blood. Prep for emergency surgery. Talk to the patient. Keep him calm, keep him alive, until the surgeon could open him up and fix what was broken. The boy survived. He would walk again, eventually, and graduate from high school, and go to college, and have children of his own. He would never know that the nurse who'd kept him alive in those critical first minutes had learned her skills in a very different kind of hospital. One with sand floors and mortar fire, and patients who sometimes didn't make it, no matter how good you were. Sarah didn't need him to know. She just needed to do her job. Dr. Harrison Grant called her into his office 3 days later. The chief of medicine's office was exactly what you'd expect. Ivy League diplomas on the wall, expensive furniture, a view of the parking lot that he probably thought looked prestigious. Grant himself matched the decor. Silver-haired, well-tailored, with the kind of confidence that came from never having his credentials questioned. Please sit. He gestured to a chair across from his desk. His smile the practiced warmth of someone who smiled at everyone, but meant it for no one. Sarah sat. I've been reviewing your performance reviews. Grant folded his hands on his desk. Dr. Torres speaks very highly of you. Says you're one of the best trauma nurses he's ever worked with. Dr. Torres is very kind. He also says you've been applying to surgical residency programs. Sarah felt the familiar tightness in her chest, the one that came whenever her ambitions were about to be dismissed. I have. With what background? Nursing school and some military service? 3 years as a Navy combat medic, including 18 months deployed to... Yes. Grant waved his hand dismissively. I've seen your file. Very impressive for what it is. But you must understand, surgical residency isn't like military medicine. We can't have people learning as they go, improvising with whatever's at hand. There are protocols, standards, a proper way of doing things. With respect, sir, I understand protocols. I also understand that sometimes... What you understand, Grant interrupted, is battlefield nursing, which is not the same as civilian medicine, not the same at all. He leaned forward, his smile taking on a condescending edge. I'm telling you this as a kindness, Nurse Chen. The surgical programs you're applying to, Johns Hopkins, Mayo, Stanford, they're looking for candidates with proper training, medical school, accredited residencies, not, he gestured vaguely, field experience. Sarah sat very still. She'd heard versions of this speech before, from admissions officers and program directors and people who'd never had to make a decision with bullets flying overhead. She'd learned to let it wash over her, to nod and agree and walk away with her dignity intact. But something about Grant's dismissiveness, the casual way he waved away years of experience, the implication that military medicine was somehow lesser, made her speak up. With respect, Dr. Grant, the field experience you're dismissing included procedures that most surgeons never perform. I've done emergency thoracotomies with a combat knife. I've packed gunshot wounds with nothing but gauze and pressure while waiting for evac that sometimes never came. I've kept people alive for hours in conditions that would shut down any civilian ER. Grant's smile didn't waver. I'm sure it was very exciting. But that's exactly my point. Exciting isn't what we need. We need methodical, proper, trained. He stood, clearly considering the conversation over. You're a good nurse, Chen. Be satisfied with that. Not everyone is meant to be a surgeon. Sarah stood too, her face carefully blank. Thank you for your time, Dr. Grant. She walked out of his office and didn't look back. The next 2 months continued as before. Sarah worked her shifts, saved her patients, collected rejection letters. She considered giving up, considered accepting that Grant was right, that her experience didn't translate, that she should be satisfied with being a good nurse. But every time she stood in a trauma bay with a dying patient, every time her hands moved with the precision that only came from repetition under fire, every time she saw something that reminded her of the friends she'd lost in service, she knew she couldn't give up. Not because she wanted to prove Grant wrong, but because she knew what she was capable of. And she knew that being capable meant she had an obligation to keep trying. The call came on a Tuesday. Sarah was in the middle of her shift when the charge nurse appeared at her elbow with an odd expression. Chen, there's a call for you at the front desk. Can you take a message? They said it's urgent and... The charge nurse hesitated. They asked for you by a name I've never heard. Sarah's blood went cold. What name? They called you Shadow. Nobody had called her Shadow in 7 years. It was the call sign she'd earned during her second deployment, after a mission that had officially never happened to a unit that officially didn't exist. The name had followed her through 18 months of operations that were classified at the highest level. Operations that she'd never spoken about, never would speak about, not even to the therapists the Navy had provided during her transition back to civilian life. How anyone at Westbrook Medical Center's front desk could know that name was beyond her comprehension. But she knew who must be on the other end of that call. Sarah walked to the front desk on legs that felt slightly unsteady. The first time she'd felt unsteady in years. The receptionist held out the phone with wide eyes. They said they'd wait. Sarah took the receiver. "This is Chen." "Shadow." The voice on the other end was crisp, military, immediately familiar. "This is Colonel James Wright. We need you." Colonel Wright, her former commanding officer in the unit that didn't exist. The man who'd recommended her for the commendation she'd received in a classified ceremony that her own family didn't know about. "Sir, it's been a long time. Too long, and I wouldn't be calling if it weren't necessary." A pause. "We have a situation. A team in a location I can't name has casualties they can't evacuate. Local medical support is compromised. We need someone who can operate in austere conditions, someone who knows our procedures, someone the team trusts." "Sir, I'm not..." "You're still the best combat medic I've ever served with. Your separation doesn't change that. And your current employer is about to receive a call from someone they can't refuse." "What?" "The Secretary of Defense would like to formally request your services. Temporarily, of course. We'll have you back before anyone notices you're gone." Sarah's head was spinning. "Sir, I work in a suburban ER now. I haven't..." "You haven't forgotten. You can't forget. And right now, there are people who need you. People who will die without you." Wright's voice softened slightly. "I know what you've been through. Sarah, I know why you walked away. But some callings don't let us walk away completely. Not when people need us." Sarah closed her eyes. She thought about the rejection letters, about Dr. Grant's condescension, about all the people who told her that her experience didn't count, didn't matter, didn't translate. And she thought about the people Wright was describing. People in a location she couldn't name, with injuries she couldn't imagine, waiting for help that might never come. "Where do I report?" The helicopter landed on the hospital roof 45 minutes later. Sarah had spent those 45 minutes finishing her shift paperwork and briefing the incoming nurse on her patients. She hadn't said anything to anyone about the call or the helicopter or the mission that didn't exist. She'd simply done her job until her job changed. The hospital, however, was not handling the situation as calmly. The CEO had received a call from the Pentagon. The chief of medical staff had received a call from the Pentagon. Dr. Harrison Grant had received a personal call from the Secretary of Defense, explaining that Nurse Sarah Chen was being activated for a classified mission and that any interference would be considered a matter of national security. Grant was standing in the hallway when Sarah walked toward the elevator to the roof, his face a mask of confusion and something that might have been fear. "Chen, what the hell is going on?" "I'm needed elsewhere, sir." "Needed? By whom?" "The Pentagon just called me personally." "The Pentagon? Asking about a nurse?" Sarah paused. She knew she shouldn't say anything, knew that everything about her past was classified, knew that explaining would only create more problems. But something about Grant's face, the disbelief, the inability to process that a nurse might be important enough for the Pentagon to call, made her speak. "Did they use my name, Dr. Grant? Or did they use something else?" "They..." Grant stopped. "They called you Shadow. What does that mean?" "It means that the field experience you dismissed isn't what you thought it was." The elevator doors opened. Colonel Wright was standing inside, his dress uniform immaculate, his rows of medals gleaming. "Shadow," he saluted. "Good to see you." Sarah returned the salute with a precision that made Grant take a step back. "Good to see you too, sir. Ready?" "Always." She stepped into the elevator without looking back, but she heard Grant's voice as the doors closed. "Who is she?" And she heard Wright's response just before the doors sealed. "She's the person who's going to save the lives your proper training never prepared you for." The mission lasted 9 days. Sarah couldn't talk about where she went or what she did. She couldn't talk about the injuries she treated, or the procedures she performed, or the lives she saved. She couldn't talk about the moment when everything went wrong, or the improvisation that made it right, or the expression on a young soldier's face when he realized he was going to survive. She couldn't talk about any of it, and she never would. But she came back different. Or maybe she came back the same person she'd always been, the combat medic who happened to work as a civilian nurse. Maybe what changed was the hospital's perception of her. Dr. Grant was waiting when she returned. He looked like he hadn't slept in days. "Chen, I need to..." He stopped, started again. "I owe you an apology." Sarah waited. "I made assumptions about your experience, about what military medicine meant. I was wrong." He took a breath. "I've also been contacted by Johns Hopkins. Apparently someone with significant influence has recommended you for their surgical program. They'd like you to interview next month." Sarah felt something shift in her chest, something that might have been hope. "Thank you, sir." "Don't thank me. I didn't do anything." Grant looked at her with an expression she'd never seen from him before. Something like respect. "But I'd like to. I'd like to write you a recommendation letter. A real one. Not the form letter I would have written before." "What changed your mind?" "The Pentagon called me. The Secretary of Defense called me. And when I asked what you'd done to deserve that kind of attention, they said it was classified." Grant shook his head. "I've been in medicine for 30 years, Chen. I've never met a nurse who had classified credentials. That means something. It means I did my job, in difficult circumstances. It means more than that." Grant extended his hand. "Welcome back, Shadow." Sarah shook it. "It's Chen, sir. I'm back to being Nurse Chen now." "Of course." Grant smiled, a real smile this time. "But I suspect Shadow isn't gone entirely. People like you never really leave that behind." He was right about that. But Sarah didn't mind. Some experiences don't translate to civilian life. And some experiences make you exactly what civilian life needs, even if no one recognizes it until the Pentagon calls. Sarah Chen started her surgical residency at Johns Hopkins the following fall. She was older than her fellow residents, quieter, with a steadiness that some found unnerving and others found reassuring. When the attendings asked where she'd learned certain techniques, procedures that weren't taught in medical school, approaches that seemed to come from a different kind of training entirely, she just smiled and said she'd had good teachers. She didn't talk about the unit that didn't exist. Didn't talk about the Callsign or the missions or the friends she'd lost and saved. Didn't talk about Dr. Grant's dismissal or the Pentagon's call or the helicopter that had landed on a suburban hospital's roof to take her somewhere she couldn't name. She just did her job. Her colleagues at Hopkins quickly learned that Sarah wasn't just competent. She was exceptional in ways that defied easy explanation. When a complex trauma came in, she seemed to know instinctively what to do, her hands moving with a precision that appeared almost supernatural to observers who didn't understand where it came from. One night, a patient arrived with injuries from an industrial accident. Multiple penetrating wounds, severe blood loss, damage to organs that usually meant death before any surgeon could intervene. The attending on duty looked at the chart and shook his head. "We're going to lose this one. The damage is too extensive." Sarah stepped forward. "Let me try something. Chen, there's no procedure for this. The injuries are incompatible with..." "I've seen this before," Not exactly this, but close enough. There's a technique. It's not in any textbook, but it works. The attending hesitated. Protocol said he should refuse, should follow the standard of care, even if the standard meant watching the patient die. But something in Sarah's eyes, the absolute certainty, the calm conviction, made him step back. Show me. Sarah operated for 7 hours. She improvised techniques that the attending had never seen, adapting principles she'd learned in circumstances she couldn't discuss to a situation that officially had no solution. She worked past exhaustion, past the point where most surgeons would have given up, driven by the knowledge that she could do this, had done things like this before, would not let another patient die if there was any way to save them. At the end, against every statistical probability, the patient was alive. "Where did you learn that?" the attending asked as they scrubbed out. "Field training, a long time ago." "That wasn't field training. That was... I don't even know what that was." Sarah smiled slightly. "It was doing whatever it takes to keep someone alive. That's all medicine really is in the end. Finding a way when there isn't supposed to be one." The story spread through the hospital, then through the medical school, then through the broader community of trauma surgeons who traded stories of impossible saves and miraculous recoveries. Nobody could quite explain what Sarah Chen had done that night, and she certainly wasn't offering details. But everyone agreed on one thing. She was special in ways that transcended standard medical training. The first time Sarah spoke publicly about her background was at a symposium on military medicine 3 years after completing her residency. She'd been invited to discuss the transition from military to civilian practice, a topic she knew intimately, though from a perspective that most of the audience couldn't imagine. The other speakers were Army surgeons and Navy physicians, people with documented service records and declassified experiences they could share freely. Sarah's presentation was different. "I can't tell you the specifics of my service," she began. "Classification restrictions prevent me from discussing locations, operations, or outcomes. What I can tell you is this: the skills I learned in service, skills that some people dismissed as irrelevant to civilian practice, have saved lives that would otherwise have been lost." She spoke about the principles of field medicine without revealing classified details, the importance of rapid assessment, the value of improvisation when standard resources aren't available, the psychological resilience required to function under extreme pressure. She talked about the transition challenges she'd faced, the dismissive attitudes she'd encountered, the long road to recognition that many veterans traveled. And she talked about what needed to change. "We have thousands of veterans with extraordinary medical experience," she said. "Combat medics who've performed procedures that most physicians will never attempt. Nurses who've managed trauma situations that would overwhelm civilian facilities. Technicians who've maintained equipment and systems under conditions that civilian healthcare can barely imagine." She paused, looking out at an audience that included military officials, healthcare administrators, and academic leaders. "We need to do better at recognizing this experience. Not giving veterans free passes, they should meet the same competency standards as everyone else. But evaluating them fairly, understanding that non-traditional backgrounds don't mean inferior qualifications. In many cases, they mean exactly the opposite." The applause was sustained, but more importantly, the conversation changed. Veterans groups cited her speech and advocacy efforts. Medical schools began creating alternative pathways for military-trained applicants. Hospitals developed assessment tools that could evaluate skills learned outside traditional educational settings. It wasn't a complete solution. Systemic change never happens overnight. But it was a start. And it gave Sarah hope that the next shadow, the next exceptional person being dismissed because their experience didn't fit the expected pattern, might have an easier path than she'd had. 10 years after the Pentagon call that changed everything, Sarah returned to Westbrook Medical Center, not as an employee, as a speaker at the hospital's annual medical education conference. The invitation had come from Dr. Torres, now the chief of medicine himself, who'd watched Sarah's career with pride and occasionally called to consult on difficult cases. "I want the residents and nurses to hear from you," Torres had explained. "They need to understand that excellence doesn't always look the way they expect." Sarah had agreed, partly because she valued Torres's support over the years, and partly because she remembered what it had felt like to work at Westbrook, to be dismissed by people who couldn't see past her non-traditional resume. The hospital had changed in 10 years. New buildings, new equipment, new faces in the hallways. But the atmosphere felt different too. More inclusive somehow, more open to the possibility that exceptional people might come from unexpected places. She wondered how much of that change had been driven by what happened the day the Pentagon called. Her presentation was scheduled for the main auditorium, a space that could hold 300 people. When she arrived, it was standing room only. Nurses, residents, attendings, administrators, even some community members who'd heard about the military surgeon who'd gotten her start at Westbrook. Torres introduced her warmly, summarizing a career that had taken her from classified operations to suburban ER nursing to world-renowned trauma surgery. He mentioned the innovations she'd pioneered, the lives she'd saved, the advocacy work she'd done on behalf of veterans in medicine. "But what I remember most," Torres concluded, "is working with her right here, in this building, watching her save patients that nobody else could have saved, seeing her demonstrate every single day that competence comes in many forms, and that the forms we don't expect are often the most extraordinary." Sarah took the podium to sustained applause. "Thank you, Michael. And thank you all for coming." She looked out at the audience, seeing faces that ranged from curious to skeptical to openly admiring. "I want to tell you a story about a nurse who almost gave up." She told them about the rejection letters, about Dr. Grant's dismissive meeting, about the years of being told that her experience didn't count, didn't translate, wasn't relevant to civilian medicine. "I could have given up," she said. "It would have been rational. The gates were closed, and the gatekeepers weren't interested in opening them. But I kept going, not because I was certain I'd succeed, but because I knew what I was capable of. And I believed that eventually someone would see it too." She told them about the Pentagon call, about Colonel Wright's arrival, about the mission that couldn't be discussed but had changed everything. "What I learned from that experience isn't just that persistence pays off, though it does. What I learned is that the systems we use to evaluate people are imperfect. They miss excellence when it comes in unfamiliar packages. They reject candidates who could be extraordinary because their backgrounds don't match a predetermined template." She looked directly at the audience. "Everyone in this room has the power to change that. You can ask questions instead of making assumptions. You can look for capability beyond credentials. You can give people chances that the system would deny them, and be amazed by what they accomplish when someone believes in them." The applause that followed was more than polite acknowledgement. It was recognition of a truth that many in the audience had sensed but never heard articulated so clearly. After the presentation, Sarah spent 2 hours meeting with attendees, nurses who'd served in the military and faced similar dismissal, administrators trying to create more inclusive evaluation systems, residents curious about paths they'd never considered. To each of them, she offered the same message. Your experience matters, even if others can't see it yet. Keep demonstrating what you're capable of. And when you're in a position to evaluate others, remember what it felt like to be dismissed. But sometimes, Late at night in the on-call room, she'd think about all the nurses and medics out there who'd been told their experience didn't count. All the people with non-traditional backgrounds who'd been dismissed by gatekeepers who'd never faced what they'd faced. And she'd hope that maybe, someday, things would change. That military experience would be valued instead of dismissed. That the skills learned under fire would be recognized as the extraordinary training they were. Until then, she'd keep proving it. One patient at a time, one life at a time. That was what Shadow did. That was what Shadow had always done. If you're a veteran watching this, struggling to have your experience recognized in civilian life, know that you're not alone. The skills you learned in service are valuable, even when the gatekeepers don't understand them. And if you're a gatekeeper, an employer, an admissions officer, anyone who decides who gets a chance and who doesn't, maybe think twice before dismissing non-traditional experience. You might be looking at the most qualified candidate you'll ever meet. Subscribe for more stories of hidden heroes and earned respect. And drop a comment about a time when someone underestimated you and found out they were wrong. Until next time. Some experiences can't be taught in classrooms, but that doesn't make them any less real. The path that had led Sarah Chen to that moment, standing in a suburban ER, being dismissed by a man who'd never seen what she'd seen, began 10 years earlier in a recruiting office in San Francisco. She'd been 20 years old, finishing her nursing degree and drowning in student debt. The Navy recruiter had made it sound simple. Serve for a few years, get your loans paid off, gain experience that would make you competitive for any job afterward. He hadn't mentioned that experience would include things she could never put on a resume. Things that happened in places that didn't officially exist. Things that would haunt her dreams for the rest of her life, even as they made her one of the most capable medical professionals in the world. Basic training was exactly what Sarah expected. Hard, demanding, designed to break down civilian habits and rebuild them as military discipline. She was good at it. The physical challenges that overwhelmed some recruits came naturally to her, and the mental pressure that cracked others just sharpened her focus. It was during advanced medical training that the instructors started to notice her. "Chen has something," one of them wrote in an evaluation that Sarah wouldn't see for years. Unflappable under pressure, precise with her hands, makes decisions faster than most without sacrificing accuracy. Recommend for advanced placement. That recommendation changed everything. Instead of being assigned to a standard medical unit, Sarah was selected for specialized training with a program that didn't appear in any official Navy documentation. The instructors introduced themselves by first names only. The facility had no signs or markings. The other trainees, 12 of them in total, never discussed their backgrounds or assignments. They learned field surgery techniques that weren't taught in any civilian medical school. They practiced procedures on mannequins rigged to spray blood and scream in simulated pain. They were subjected to sleep deprivation, extreme cold, extreme heat, and constant psychological pressure designed to reveal how they performed when everything was falling apart. 3 of the 12 washed out in the first month. 2 more left voluntarily after the psychological training became too intense. By the end of the 6-month program, only 4 remained. Sarah was one of them. Her first deployment was to a country she still couldn't name, to support an operation she still couldn't discuss. The official record showed that she was assigned to a naval hospital ship in the Mediterranean. The unofficial reality was that she spent 9 months on the ground in a conflict zone, attached to a special operations team whose missions ranged from routine to terrifying. The first time she performed surgery under fire, she was 23 years old. The patient was a team member who'd taken shrapnel to the abdomen. The operating room was the back of a damaged vehicle, illuminated by flashlights held by two other operators, while a third provided security. The tools were a combat surgical kit, improvised clamps made from bent metal, and sutures she'd sterilized with a cigarette lighter. The firefight was still audible in the distance. The crack of rifles, the thump of explosions, the occasional burst of automatic weapons. At one point, a round punched through the vehicle's skin about 3 feet from Sarah's head. She didn't flinch. She couldn't afford to. The surgery took 47 minutes. The patient survived. He was evacuated 6 hours later, and Sarah learned months afterward that he'd made a full recovery. Outstanding work under extreme conditions, her commanding officer wrote in her first operational evaluation. Recommend for continued special duty assignment. That assignment lasted 3 years. The call sign Shadow came from her second deployment. She'd been attached to a team operating in a mountainous region, providing medical support for reconnaissance missions that took them deep into hostile territory. The terrain made evacuation nearly impossible. If someone got hurt, Sarah was their only hope until they could reach an extraction point, which could be days away. She learned to move silently through the darkness, to set up treatment areas in caves and abandoned buildings, to operate on patients who couldn't be sedated because they needed to stay alert for security. She learned to carry 3 days' worth of medical supplies on her back while keeping pace with operators who trained constantly for exactly these conditions. One night, during a particularly dangerous mission, the team was moving through a canyon when they triggered an ambush. Rounds came from 3 directions, and in the chaos, Sarah found herself separated from the main group with a wounded operator who couldn't walk. She dragged him into a shallow depression behind a boulder, applied a tourniquet to his shattered leg, and held her pistol ready while the firefight raged around them. When enemy fighters moved toward their position, she'd waited until they were close enough that missing was impossible, and engaged with the calm precision she'd learned in all those months of training. 3 shots, 3 targets down. When the team regrouped after the ambush, the team leader looked at the bodies near Sarah's position and then at her. "You moved like a shadow," he said. "We didn't even know you were there until it was over." The call sign stuck. By the time Sarah completed her 3rd deployment, she'd accumulated experience that most medical professionals never gain in a lifetime. She'd performed emergency surgeries in conditions ranging from combat to natural disaster. She'd treated gunshot wounds, blast injuries, burns, hypothermia, hyperthermia, dehydration, and a dozen other conditions that required immediate intervention to prevent death. She'd improvised treatments when supplies ran out, adapted techniques when standard approaches weren't possible, and made life-or-death decisions in seconds that civilian doctors would have committees to discuss. She'd also lost patients. That was the part nobody talked about in the recruitment office, the part that no amount of training could fully prepare you for. The moment when you'd done everything right, used every skill you had, pushed your body and mind to the absolute limit, and still watched someone die. Sarah carried those losses with her. She'd learned to compartmentalize, to function despite the grief that never fully went away. But she couldn't forget them. Couldn't forget their faces, their names, the promises she'd made that she couldn't keep. Those losses were part of what had driven her out of special operations and back to the civilian world. She'd told herself she needed a change, needed to use her skills in a context that didn't involve combat. But part of it was simpler than that. She needed to stop watching people die in her arms. The suburban ER seemed like the perfect escape. Routine cases, standard procedures, nothing that would remind her of what she'd seen. She'd been naive about that. The first time Sarah's past intruded on her present, She was 3 months into her job at Westbrook Medical Center. A young woman came into the ER with injuries that the attending physician initially diagnosed as domestic accident. Bruises on her arms, a cut on her forehead, a story about falling downstairs. Standard stuff, according to the nurses who'd been working there for years. But Sarah had seen these injuries before. Not in domestic situations, in interrogation settings, in places where people were hurt deliberately, methodically, to extract information or send messages. She'd pulled the attending aside and spoken quietly. "This isn't a fall. Look at the pattern of the bruising. Look at where the cuts are placed. Someone did this to her." The attending had been skeptical at first. "With all due respect, Nurse Chen, I've been doing this for 20 years. But Sarah had persisted, pointing out specific indicators that she couldn't explain without revealing more than she should about her background. In the end, the attending had called the police. The investigation revealed that the young woman had been trafficked, held against her will by a criminal organization. Sarah's observation had potentially saved her life and definitely led to the rescue of 6 other women from the same operation. "How did you know?" the attending asked afterward. "I've seen it before." "Where?" Sarah had just shrugged. "Around." She couldn't tell him the truth, couldn't tell him about the training she'd received in recognizing torture injuries, or the briefings she'd attended about human trafficking operations that sometimes intersected with military missions, or the facility she'd helped shut down in a country she couldn't name where similar injuries were common. All she could do was apply her knowledge and hope nobody asked too many questions. The pattern repeated over the following months. Sarah would notice something that other nurses missed. A drug interaction that the pharmacy had overlooked. A symptom pattern that suggested a rare condition. A patient whose story didn't quite match their injuries. She'd mention it quietly, never making a fuss, never claiming credit. And more often than not, she'd be right. Dr. Torres started requesting her specifically for difficult cases. The ER staff began deferring to her judgment on complex trauma situations. Even the hospital administration, which usually paid no attention to individual nurses, noticed that outcomes improved when Sarah Chen was on shift. But Dr. Harrison Grant noticed something else. A nurse who was stepping outside her designated role, who was making calls that should have been made by doctors, who was demonstrating competence that embarrassed some of the physicians on staff. To Grant, Sarah Chen wasn't an asset. She was a problem. The meeting in Grant's office wasn't the first time he'd expressed displeasure with Sarah's performance. He'd spoken to her twice before, once about maintaining appropriate professional boundaries, after she'd suggested a diagnosis that contradicted an attending's opinion. She'd been right, and the patient had been saved. And once about chain of command issues, after she'd called a surgeon directly rather than waiting for the attending to page them. The 5-minute difference had saved a stroke patient's life. Both times, Sarah had nodded and apologized and gone back to work. She understood institutional politics, understood that rocking the boat could cost her the job she needed to pay her bills and maintain some semblance of normal life. She'd survived environments where challenging authority could get you killed. She could certainly survive environments where it only got you reprimanded. But the conversation about her residency applications was different. This wasn't about an individual case or a specific decision. This was about her entire future. About the dreams she'd carried since before she joined the Navy. Dreams that had sustained her through the worst moments of her deployments. Dreams that Grant was now dismissing as unrealistic. Field experience, he'd said, as if it were meaningless. Sarah thought about the surgery she'd performed in the back of a bullet-riddled vehicle. She thought about the improvised treatments she'd created when standard supplies ran out. She thought about the techniques she'd developed for operating in conditions that would shut down any civilian hospital. Field experience. As if it were nothing. The weeks after Grant's meeting were the hardest of Sarah's civilian career. She continued her work in the ER, continued saving lives and catching problems that others missed. But every shift felt like a reminder of what she couldn't have. The surgical training that would let her use her full capabilities. The career advancement that was being denied because the wrong people controlled the gates. She considered leaving. Considered finding a hospital where her background might be appreciated rather than dismissed. Considered, in her darkest moments, whether civilian medicine was even possible for someone who'd seen what she'd seen. But she stayed. Partly because she needed the job, partly because the patients needed her, and partly because somewhere deep down she still believed that persistence could overcome prejudice. She just didn't expect that persistence to come in the form of a phone call from the Pentagon. The helicopter ride to the staging area took 4 hours. Sarah spent most of it reviewing mission briefings and medical protocols, refreshing skills she hadn't used in years but had never truly forgotten. The mission parameters were familiar. A team in a hostile location, casualties they couldn't evacuate, local support compromised. But the details were unique enough to require careful preparation. Colonel Wright sat across from her, watching her review the materials with an expression that mixed concern and confidence. "You sure about this?" he asked during a lull in the briefing. "No, but I'm going anyway." "That's what I always liked about you, Shadow. You never pretended to be fearless, you just did it anyway. Being fearless gets you killed. Being competent despite the fear keeps you alive. And your patience. And my patience." Wright nodded, and they flew on in silence. The 9 days that Sarah spent on the mission tested everything she'd learned in her years of special operations medical training, and some things she'd learned since. She couldn't discuss the specifics, would never be able to discuss them, but she could remember the moments. The first patient she'd treated, lying on a makeshift table in a structure that provided minimal protection from the elements. The improvised surgical procedures she'd performed with tools that were inadequate for the task, but were all she had. The impossible choices she'd made about resource allocation, about which patients could wait and which couldn't. She remembered the fear. Because there was always fear, no matter how experienced you became. The fear of making mistakes, the fear of not being good enough, the fear of watching someone die because you couldn't figure out how to save them. And she remembered the triumph. The patient who'd survived against all odds because Sarah had remembered a technique from her training that nobody else on the team knew. The soldier who'd walked out of that place under his own power because Sarah had recognized the early signs of a condition that would have killed him in hours if left untreated. The members of the team who'd gone home to their families because Shadow had been there to patch them up when everything went wrong. Those were the moments that made it worth it. Those were the moments that reminded her why she'd chosen this path in the first place. The flight back to the United States felt longer than the flight out. Sarah was exhausted, the kind of bone-deep exhaustion that came from days of operating on minimal sleep in high-stress conditions. But she was also oddly at peace. She'd been tested, and she'd passed. She'd been called upon to use skills that the civilian world dismissed as irrelevant, and those skills had saved lives. Whatever happened next, she knew who she was, what she was capable of. Colonel Wright sat beside her as they crossed the Atlantic. "I spoke to some people about you," he said. "About your situation." "What situation?" "The surgical residency applications, the rejections, the hospital administrator who thinks combat medicine doesn't count." Sarah tensed. "Sir, let me finish." Wright held up a hand. "The people I spoke to, they have influence. The kind of influence that opens doors. They can't force any program to accept you, but they can make sure your application gets the consideration it deserves. I don't want special treatment. It's not special treatment, it's fair treatment. You've earned consideration based on your qualifications. The fact that your qualifications are classified doesn't mean they don't exist. Sarah was quiet for a long moment. What do I have to do? Nothing you haven't already done. Your work on this mission speaks for itself. The people who matter will know what you accomplished, even if the details stay classified. And when they see your application, they'll understand that field experience isn't a weakness. It's an extraordinary strength. And if it doesn't work, if the programs still reject me, then you keep trying. Because that's what you do, Shadow. You don't give up. You adapt, improvise, and overcome. That's what makes you who you are. The Johns Hopkins interview happened 3 months after Sarah returned from the mission. She'd approached it differently than her previous interviews, not downplaying her background, but not apologizing for it either. When the admissions committee asked about her experience, she answered honestly within the limits of classification. I can't discuss the specifics of my deployments, but I can tell you that I've performed emergency surgical procedures in conditions that would be impossible to replicate in any civilian setting. I've made life or death decisions in seconds that most physicians have minutes or hours to consider. I've adapted standard techniques to non-standard situations and developed new approaches when standard ones weren't available. The committee had asked more questions. Sarah had answered as fully as she could, drawing on the principles of her training without revealing classified details. She'd shown them hands that had never trembled in surgery, eyes that had seen things most people couldn't imagine, a calm that came from having survived experiences that would break most people. By the end of the interview, she knew she'd done everything she could. The outcome was out of her hands. The acceptance letter arrived 6 weeks later. Dr. Harrison Grant was at the hospital when Sarah came to submit her resignation. He was different now. Quieter, more respectful, lacking the condescension that had characterized their previous interactions. The Pentagon's call had shaken something in him, forced him to reconsider assumptions he'd held for years. I owe you an apology, he said when she came to his office. You mentioned that before. I want to say more. He stood, walked to the window, looked out at the parking lot where Sarah's unremarkable car sat among the Mercedes and BMWs of the senior staff. I've been in medicine for 30 years. I thought I understood what qualifications looked like. I was wrong. With respect, sir, you weren't entirely wrong. My experience is unconventional. It doesn't fit neatly into standard categories. I understand why it was difficult to evaluate. It shouldn't have been difficult. I should have asked more questions instead of making assumptions. He turned to face her. The recommendation letter I'm sending to Johns Hopkins, it's the best letter I've ever written, because you're the best candidate I've ever had the opportunity to recommend. Thank you. That means a lot. It should, because I don't say things I don't mean. Grant extended his hand. Good luck, Dr. Chen. I expect great things from you. It's still Nurse Chen, sir, until I finish my residency. In my mind, you're already Dr. Chen. You were probably Dr. Chen before I ever met you. It just took me too long to see it. Sarah shook his hand, collected her resignation paperwork, and walked out of Westbrook Medical Center for the last time. Behind her, Grant watched her go, thinking about all the assumptions he'd made over the years, and all the extraordinary people he might have dismissed because they didn't fit his narrow expectations of what excellence looked like. He decided, in that moment, to start asking more questions. Dr. Sarah Chen completed her surgical residency at Johns Hopkins 3 years later. graduating at the top of her class. She specialized in trauma surgery, no surprise to anyone who knew her history, and developed innovative techniques for treating blast injuries and gunshot wounds that drew on her classified experience in ways that couldn't be directly discussed, but were obviously informed by something beyond standard medical training. Her colleagues at Hopkins never fully understood where her skills came from. They just knew that when the difficult cases came in, the ones that tested everything the trauma team had, Sarah Chen was the person you wanted in the room. Her hands were steady, her decisions were sound, and her presence made everyone around her better. Some of them suspected there was more to her story than she'd shared. A few asked questions that she politely declined to answer. But nobody doubted her competence, and nobody questioned whether her non-traditional background was relevant to her abilities. It was obvious that whatever she'd done before Hopkins, it had prepared her for exactly this work. Years later, when Sarah was an established surgeon with a teaching position at a major medical school, she would sometimes speak to students about the importance of non-traditional experience. Medicine isn't just about what you learn in classrooms and textbooks, she would tell them. It's about applying principles in real situations, under real pressure, with real consequences. Some of the best medical professionals I've ever known had backgrounds that looked unconventional on paper. Military medics, rural nurses, international volunteers, people who learned by doing, who developed skills through necessity rather than curriculum. How do you evaluate that kind of experience? A student once asked. You ask questions. You listen to the answers. You look beyond credentials to capability. And you never assume that someone's background disqualifies them from greatness. She would think, in those moments, about Dr. Grant and his dismissive assumptions, about the rejection letters and the closed doors and the years she'd spent being told her experience didn't count. And she would think about the patients she'd saved, in combat zones, in suburban ERs, in world-class hospitals, because she'd refused to accept other people's limitations on what she could become. That, she believed, was the real lesson. Not that the system was unfair, though it often was, but that persistence and excellence could overcome unfairness. That the people who dismissed you today might respect you tomorrow, and that the only limitations that truly mattered were the ones you accepted for yourself. Sarah Chen never talked publicly about the mission that had changed everything. The 9 days, the Pentagon call, the helicopter that landed on a suburban hospital's roof. But every year, on the anniversary of that mission, she received a call from someone who had been there. Someone who remembered what she'd done and wanted to thank her again. Someone who was alive because Shadow had answered when her country called. Those calls meant more to her than any award or accolade. They were reminders of what she'd accomplished, what she was capable of, what all her non-traditional experience had prepared her to do. And they were reminders of why she kept pushing, kept advocating for veterans in medicine, kept mentoring students from unconventional backgrounds, kept fighting against the assumptions that had almost derailed her own career. Because somewhere out there, she knew, was another Sarah Chen, another Shadow, another extraordinary person being dismissed because their experience didn't fit the expected pattern. And if her story could help even one of them find their way, could give even one of them hope that persistence pays off, then everything she'd been through would be worth it. If you're watching this and struggling to have your experience recognized, whether you're a veteran, a career changer, or just someone whose path doesn't look like everyone else's, remember this: the gatekeepers aren't always right. Your experience matters, even if they can't see it. And the best way to prove them wrong is to keep going, keep growing, keep demonstrating what you're capable of. Subscribe for more stories of people who refuse to be limited by other people's assumptions. and drop a comment telling us about a time when someone underestimated you and learned they were wrong. Until next time. Some experiences can't be taught in classrooms, but that doesn't make them any less real or any less valuable.